My name is Dr. Peter Stehling. I'm a German orthopedic surgeon, and I want to tell you something about a very new kind of technology of pain treatment that calls CRYOFOS. The CRYOFOS is a special treatment with a neuroreflex stimulation. That means we cool down the skin in about 30 seconds to 2 to 4 degrees, and that makes the neuroreflexive answer and makes the vessels wide in the deep, so we get rid of the inflammation mud like prostaglandin, histamine and serotonin. We have a CRYOFOS combines the effects of the cold pressure by using the hyperbaric CO2 gas. That means we are using the body's own resources to combat the pain. The skin temperature is lowering between 2 to 4 degrees. This abrupt temperature change generates a neuroreflexive response in the body. It generates an innovative and successful treatment in comparison with the known cold air treatments or ice treatments. Here we offer two kinds of models of CRYOFOS. That means we have the office model and the CRYOFOS mobile model. The office model is for hospitals or praxis, and the other one is for sporting fields, just football or other kind of sports. The comparison of the existing types of cooling, we have here different parts. So we have the old common ice use from 32 to 0 degree. We have the low temperature of the sprays, you know, also from sports. And we have the very low temperature with 78 degrees minus used in the CRYOFOS. That means in a neuroreflective stimulation. So in this part we have only the ice, and the ice means I never will get the neuroreflective situation. So I want to cool it fast down to 2 to 4 degrees. Even if I have this low temperature with this cooling spray, I have, for example, 30 or 32 degrees minus, but I never will reach with the spray, never will reach this kind of thermoshock, which is necessary to get the NRS. In the neuroreflex therapy, we have the 78 degrees minus, and that means we have a very fast cooling down the skin, a thermoshock, which is causing then an NRS. That means a neuroreflex stimulation to open the deep vessels and to transport all the inflammatory mud away. Inflammatory mud like prostaglandin, histamine, serotonin, which makes the inflammation and keeps also the edemas on. So if I get rid of this, I have the result of my therapy. Here we have the most important comparison curve against ice therapy versus NRS therapy with CRYOFOS. That's very important to understand what happens here. So we have the ice curve here. You see we get at least at 25 minutes the lowest temperature of the skin. That means about 10 to 12 degrees. But that's not enough to get a thermoshock, and that's why we use or need something we can reach this thermoshock. And this thermoshock we can get if we take the CO2 gas. The CO2 gas cools down the skin in about 30 seconds to 2 to 4 degrees and recover again after 5 minutes. With the ice, you need at least 1 hour to get the normal temperature again. So I have a great risk that I get a cell damage here. Here with the cooling down between 30 and 60 seconds, I have the neuroreflex stimulation, and then I have a recovering very fast, and I never get the cell damages. I want to introduce you the CO2 gas, the medical CO2 gas with minus 78 degrees. And the specification is colorless, it's odorless, it's non-flammable, which is very important. It's poor, it's dry, and it's bacteriostatic also, and that's very important also to reduce the infect risk. The technical application is also very important to do it in the right way, otherwise I don't have a result of this. So we have a 78 degrees minus. If I point it to one point, then I have the risk of a necrosis. Therefore, I have always moving the pistol that we have a very good cooling down of an area. But anyhow, if there is a point holding on the skin, we have a unique safe system which inhibits the burnings, because the system is shuts down in about 1 second with -1 degrees of the skin surface. The sensitive receptors of the skin is the key where we get the result of. Why? We have 3 layers of the skin, and in these 3 layers we have the receptors of cool, of heat, of vibration, and so on. So in 1 square centimeter of skin we have 200 pain receptors, we have 2 heat receptors, but we have 13 cold receptors. That means we have a much better reaction if we have a cooling down the skin instead of heating the skin. So the effect is much better also in relaxing the muscle which is down. So with the CRYOFOS therapy, with the neuroreflex therapy stimulation, we have a specialty. We have 2 afferences to the brain. The 2 afferences is one side, the pain and temperature over the lateral spinothalamicus tractus, and the other one is the touch, pressure, and the vibration. It's going to the ventral spinothalamicus tractus. So we have a potentiation of, through these conditions, via the both tracts, and nothing can reach this except the neuroreflective stimulation via CRYOFOS. So we have a very broad range of physiological effects. We have once the analgesic effect through the inhibition of the nociceptors. We have the anti-inflammatory effect through immediately suppression of enzymes. We have a vasomotoric effect through deep vasodilatation within the 20 to 30 seconds. And we have a neurological effect through muscle relaxation as a result of myostatic reflex in the medulla. We have a broad indication base. So we have the trauma, the surgery, hand surgery, sports medicine. We have the physiotherapy, the rehab care and treatments, the emergency medicine, rheumatology, neurology, and the implantology with dentistries for implantation of tooth or like this. Of course, you don't treat it inside the mouth, but you treat it outside the mouth. So we have special indications for some kinds: acute sports injuries, bruising, hematomas, strained or torn muscles and rheumatism, epicondylitis radialis and ulnaris, its heel spur, arthrosis of the knee, upper ankle joint and vertebral joint, as well as the lumbar sciatico, chronic back pain, Sudeck syndrome, stage 1 and 2, post-surgery treatments, and any more. Here we have some samples for the indications. So we are treating, for example, the epicondylitis radialis. Here we are treating at that point where you have the pain and the belonging ways of the lymphatic system. So I straighten the arm, and then I make the therapy also here to induce the lymphatic drainage. Indications are more lumbago and lumbar sciatica. It's a treatment along the muscles on the back here and the both sides, and so that's it. More indications is cervical syndrome, trapezius myoglose, cephalgia. So I make the treatment here along the basic of the hair beginning, then along the muscle here, and along here the muscle trapezius to relax the muscle. And this should be also treated on the both sides that I prevent muscular disbalance. After radius fractures or Sudeck syndromes up to second degree, we treat also the fingers. We have a very good lymphatic system on the fingers, so we have to treat each finger itself and the thumb and the way where the lymphatic system is. So I prevent the bad healing. Next, in the hand surgery, for example, the Dupuytren, on the 12th day after surgery, you see the sutures are still in place. Sutures will be removed after CRYOFOS therapy. Total number of treatments is 4, and you see after these 4 treatments, after the 12th day, you can move the fingers like this. That's very seldom that you can this. So that was an injury of the ligament at the ankle after a sports injury. So the next day when he came, you see here the hematoma. He was treated with the CRYOFOS. That makes the neuroreflexive reaction, and then it's disappear very fast. Here it's after 5 days. You only see a small shadow here, the rest of the hematome, and that's it. After 5 days you have this healing. Here you see an elderly lady. She was falling on the face. Of course, she had everywhere hematomes and a blessure and a failure here. So, of course, we have to exclude that there is a breaking of the head that we did. And then we begin with the treatment the first day, day 0, day 1st, day 3, day 5. So you see the immense reduction of the hematomas. Also here it's gone. Here on the 3rd day, nearly everything is gone. And here we only have a small shadow more here at these parts of the face. Here in the sports medicine, we have also a very well-known patient. She is the world championship in boxing. I know her since she was 5 years old, and she always came to me, and I was accompanying her after the boxing fights and make the treatment. So in Germany we have a very known newspaper that calls the Bild, and she is telling on the Bild, this ice pistol is my beauty secret. And so she was happy. I treated her after the fight. The next day, that was Sunday morning, and then she could go to the TV at Sunday evening and had a very nice face. That was a colleague of this Regina Halmich. She also had a fight. You see the great hematoma. And at the end of the fight, she was treated the first time. And immediately after the fight, you see the reduction of this hematoma. Of course, the scarification on the nose, I cannot heal, but I can reduce all the swelling and I can reduce the hematomas, as you see, after the 2nd treatment the next day in the morning. Now it's important to say something about the contraindications. Contraindications is, of course, the diabetic gangrene. And why the diabetic gangrene? In a diabetic situation, you have a paralysis of the vessels, and the paralysis of the vessel is not able to react with neuroreflexive stimulation. That's why it's not allowed to do this when you have a diabetic gangrene. But if there is somebody who has a diabetic type 2, you can treat him on the back or on the shoulders or on the arm. That's no problem, but not on this gangrene area. The Raynaud disease, you know, these are the fingers when they get white. If it's very cold outside, then it's forbidden to treat the fingers or even the toes or on the foot. But if they have the problem on the back, or that's like on the diabetic gangrene, you can treat it. The cryoglobulinemia, it's no problem. It's a very seldom kind of allergic reaction to the cold. I saw it once in my life with 35 years of experience, and you can forget this. But one thing is also very important: no treatments on the mucosa membrane, such as the mouth, the nose, eyes, anal, vaginal, and not, of course, in open wounds. The light cannot be applied to the open eyes. That cannot happen something, but I don't want to have it in the eyes directly because it makes it too light. The advantages of the medical practice of CRYOFOS and the NRS therapy: we have it in a naturopathic therapy, we have it easy to use, it's broad indication base, we have extremely high patient satisfaction level with numerous referrals and recommendations all over the world, offering cutting-edge technology to your patients and 100% safe to use due to the advanced and the tested specifications. Thank you for listening and watching my presentation about the CRYOFOS device, and hopefully it can help you and your patients to do it in the same way for the future, and I thank you so much.